something less serious. There are key symptoms which I'll list in a second, but just because incontinence, apart from with ovarian cancer, isn't really linked to the others in the most common symptoms, that obviously doesn't mean that people should ignore it. And the most important thing for Anne is that, Anne, you experienced something that wasn't normal for you, and now in hindsight, the pieces are being put together. But the main symptoms, so we'll just go through them quickly. So abnormal vaginal bleeding, so bleeding from your vagina when you as an individual aren't expecting to, are key signs of womb, cervical and vaginal cancer. So abnormal bleeding could be, again, if it's not normal for you, bleeding between periods, bleeding after sex, after the menopause, bleeding that's much heavier than what's normal for you if you're still having your periods. With regards to cervical and vaginal cancer as well, we'd add in any unusual discharge, any changes to discharge, any unpleasant smelling discharge, pain during sex, a pelvic vaginal pain, and then if you're having an examination inside your vagina, if you're able to check your vagina inside, feeling a lump that is new for you or a vaginal itch up inside that won't go away. Vulval cancer, so the vulva is the area between the legs of people who are born female, and that's everything from the mons pubis, where your pubic hair grows, right down to the perineum and the anus. So all of that area, it's not just the labia. Some people call them the lips or the flaps, not just the labia. So changes to the vulva. So that could be a lasting itch, persistent itch, pain or soreness. The skin has become thickened, raised, redder, darker, lighter, depending on your skin tone. Sore areas or growths, changes to any moles, lumps or bumps that are unusual, tenderness when touching your vulva. Again, if you're able to look and check your vulva, you'll notice something changes. And then ovarian cancer is the one that has the symptoms that are kind of the least vaginary or gynae. So it's not about, sort of a vulva and bleeding. It's things like persistent bloating. So not bloating that comes and goes. If you've been bloated persistently for 3 weeks or more, please speak to your doctor. It won't be a surprise that it's, often misdiagnosed as something more gastrointestinal, IBS, etc. And it's not likely to be ovarian cancer, but still it's worth speaking to your doctor about. Pelvic and abdominal pain, changes in bowel habits. So know what your sort of toilet habits and schedule is, if there is such a thing as a toilet schedule. So it could be constipation and or diarrhea that are the changes. It's not one size fits all. Difficulty eating, which is always a weird one when we think about gynae stuff. But if you're feeling full more quickly or you're feeling sick when you're trying to eat, that's something. You're not able to eat as much as you normally would. That's something to look out for. And ending on I feel like the main note for this podcast is needing to wee more regularly, more often. If you're suddenly weeing loads more and it's not because you're deciding to, right, I'm going to start drinking 3 litres of water a day, that's a change. It probably isn't a gynae cancer, but we 100% know from this conversation that it absolutely could be.
Yeah, thank you. And we can find those resources on the Eva Peel webpage, can't we?
Yeah, so evapeel.org.uk, Eva Peel at Eva Peel on social media. We constantly, especially in months of May, get Lippy, put out much more information. But yeah, lots of information, lots of different types of resources on website and social media platforms.
Brilliant.
Thank you for that. Brilliant. Yeah, brilliant. We'll put that in. We'll edit that in and then we'll put this in.
Of course, yeah. However, whatever order,
Great.
whatever you want to do, but yeah.
Again, ladies, thank you, Anne. Thank you, Karen.
Thank you
so much. Brilliant. So lovely to meet you and see you again, Anne. Thank you.
It's absolutely glorious. Thank you very much, ladies.
Go and have your dinner now, all of you.